particularly in the last couple of years, people have begun to think about aspirin as a treatment for cancer. Some of that activity has resulted from the work of Peter Rothwell, who looked at a large number of vascular studies where patients had been allocated to aspirin. And what he saw, not only did aspirin decrease the risk of developing a cancer, but it also appeared that there were less cancer deaths. And when he looked at that in more detail, he saw that these effects were happening quite early, probably within 1 to 3 years. And so that was the beginning of thinking that maybe aspirin could actually treat cancers, because within that time frame, the cancers were almost certainly already there. In addition to that, a number of people have been looking in various epidemiological studies and in big cancer registries to see if people who were diagnosed with cancer and were also receiving aspirin, how they did in comparison to people who weren't on aspirin. And what we've seen quite consistently, particularly in colorectal cancer, is that if you were on aspirin after your cancer diagnosis, you appear to do better. Well, I think we have to look across a number of areas. If you look at in vitro data and animal model data, looking back, in fact, many, many years, it appears that aspirin prevents the development of metastases, and that may be how it's working as a treatment. And we're now, as I've just said, putting that together with the data from clinical trials and from epidemiological studies, and feeling that there's certainly some evidence that aspirin could be effective, and we need to work out how to use it within all our normal treatment paradigms. There are a number of trials. Probably the most activity is in the adjuvant setting. The first trial really was the ASCOT study, which is being run in a number of countries, including Singapore and Australia. And there they were looking at using aspirin after a diagnosis of colorectal cancer. Here in the UK, we're just about to start a large study called the Add-Aspirin study. And within that, we'll have, within that, there are actually 4 separate trials. One in colorectal cancer, one in breast cancer, one in gastroesophageal cancer, and one in prostate cancer. And in each of those, patients will be randomized after they've had their treatment to either a placebo, aspirin 100 milligrams daily for at least 5 years, or aspirin 300 milligrams daily for at least 5 years. And then we'll be looking to see whether aspirin can prevent or delay the cancers coming back, and also looking at other aspects. For example, how do these patients do from a cardiovascular point of view? Well, it's just about to open. We're hoping that the first patients will be recruited in October 2015. We're planning to open in nearly 100 centres across the UK. For the gastroesophageal and the breast cohorts, the trial will also be run in India. And we're expecting recruitment to start in India in about January 2016. No, for all the participants, they will have had whatever is the standard treatment for the cancer they've got. So it may be surgery, but then in quite a number of cases they may have chemotherapy before or after. In some cases they may also they may have had, instead of surgery, they may have had radical chemoradiation, for example. So the concept very much is you have your best possible standard treatment, and then you look to see whether you can add aspirin to it, which is why it's called the Add-Aspirin study. For some of the hormonal treatments, both in prostate cancer and in breast cancer, because they're long-term treatments, you can join the Add-Aspirin study when you're taking tamoxifen, for example. I mean, there's certainly some interesting data if you look in the epidemiological literature, certainly taking aspirin after breast cancer, for example, there's some very interesting data there. In terms of prostate cancer, there's a trial that's going to to recruit patients in the UK, where they're looking at the group of men who've been diagnosed with prostate cancer, but in general it's felt not to be a particularly aggressive form of prostate cancer, and those men are usually just put on surveillance. And in that group they're looking to see whether going on to aspirin can change their outcomes, and that's called the PROVENT study. There's still quite a lot of debate about the role for aspirin, particularly in the treatment of cancer, and so in any setting where we're unsure, we would encourage physicians and oncologists to take part in ongoing trials, and also for potential participants to discuss this with their oncologists. I think one of the most exciting things actually about aspirin is we don't understand fully how the anti-cancer effects work. We don't know whether the effects on primary prevention are working through the same mechanisms as they are in potentially stopping metastases, for example. So one of the things that we can do with these trials is that we can collect samples, both blood samples, tissue samples, and then we can work with our colleagues in the laboratory to look at the various pathways. There's quite a lot of interest and excitement around platelets, and they may be either protecting tumour cells or they may be sending signals which make it easier or harder for cells to become malignant. If you're talking to your oncologist and there is an opportunity of taking part in a clinical trial, it's well worth having that conversation.